Hi, this is Dr. Woeller for Great Plains Lab. This is the Great Plains Laboratory sponsored monthly complimentary webinar on a different topic related to integrative medicine. And in this one, I thought I would do an overview or a review, essentially, on how to review an organic acids test. I mean, the organic acids test is one of the most popular tests that Great Plains Lab has. It's used all over the world. And one of the reasons is that it provides a tremendous amount of information regarding underlying biochemistry and metabolic imbalances and toxins, etc. It's a test that I've used in my practice now for almost 20 years. And I really think it's a go-to test. And it's not a disease-specific or even a condition-specific test. It has information that can be applied to a wide variety of different types of individuals. I teach a seminar on the implementation of the organic acid test into clinical practice. I'll talk about that here shortly. So you might be a practitioner listening. If you're a patient or a parent with a special needs child, I think you'll find this information useful. There's no doubt that the organic acid test can be complicated. I mean, there's a lot of markers that can indicate a variety of potential problems. Even in this lecture, I'm not going to be able to touch on every last marker, every clinical scenario there is. There's an endless amount of information, honestly, that you could delve into. But what I will say is that the vast majority of organic acid tests that are done, at least in my experience, tend to have similar looking patterns, about 80%, maybe a little bit more. And what I mean by that is that Candida, for example, shows the marker called arabinose. Well, arabinose isn't just specific for autism or isn't just specific for depression or chronic fatigue, but a lot of those types of patients tend to have problems with Candida. So regardless of the numbers on the test, you as a practitioner, if you're listening, still have to apply the information clinically to your patient. You can't just simply treat based on the numbers. Now, there are certain numbers on the test that are important to pay attention to, but it's understanding how a marker or that represents a certain imbalance applies to your patient or client. If you're a parent of a special needs child or someone else, it's important to understand that too. My hope is you come away from this talk with a deeper appreciation of the organic acid test, not to have had all your questions answered. That's just not going to happen. But as a way that you can learn to quickly assess or review an organic acid test for a patient, client, or let's say your child or yourself, to at least open up some possibilities of intervention. As I mentioned before, the organic acid test is not specific for just one group of people. It is clearly beneficial for the autistic kids, kids with ADD, ADHD, but it can be useful in kids or adults with autoimmune disorders and chronic fatigue and digestive problems. A lot of usefulness in learning about the different markers and how they apply to people with mental health problems, and certainly neurological disorders as well. So the reality is any individual with some type of chronic complex health condition, regardless of the diagnosis, the information that can be obtained from the organic acid test can be useful. Now, if you are a parent or caregiver of an individual with autism or autism spectrum disorder, I would encourage you to go to Facebook, and we have a Facebook page called Autism Recovery System, and you can follow us there. I try to post something on that Facebook page every day. Sometimes it's every couple days, but try to keep things current. It could be articles, it could be a clinical pearl from my practice, etc. We also have a new biomedical information website. AutismRecoverySystem.com is a multi-language website. In that website, we have a course called Autism Recovery 101. I'll talk about that here shortly. Videos, educational videos, webinar type videos that I create that review test samples, go through different clinical scenarios related to autism. There's a forum. There is access to my methyl B12 book. There are case studies, etc. And it's a constantly expanding and growing website. So if you need some help, if you're looking to increase your knowledge base, autismrecoverysystem.com could be worth checking out. Now, in the website, there's an entire biomedical course. This is a 6-module biomedical course that I created last year. It's about 10 to 12 hours in length in recorded material. There's also a lot of downloads and support material that go along with that course. Part of that course, I go into different treatment aspects of things I'm going to mention today: Clostridia bacteria, Candida, etc. So that course is part of the Autism Recovery System site. If you are a healthcare practitioner and you've been using Great Plains Lab for a while, or perhaps you're new, I would encourage you to attend one of the one-day intensive seminars on the implementation of the OAT into practice. We have been doing these seminars now for about 3 years. The next one is going to be in Southern California, linked to the Integrative Medicine for Mental Health Conference, and then later this year we'll have some more as well. So you can go to greatplainslaboratory.com and check out the course schedule for when the next organic acid testing workshop is going to occur. So let's talk about the OAT. There are a lot of different sections on the organic acid test, obviously, that look at a wide variety of different metabolites that are being measured through the urine. Some are more important, or I guess I should say maybe have more strong indications of problems than others. And so let's look at a sample test. Now I'm going to go through 2 different tests in this presentation. I'm not going to get a lot into treatment. We just don't have time, and that could be a whole other discussion. I've got tons of information on that in the Autism Recovery System website, and also on past webinars through Great Plains. One thing to keep in mind about the organic acid test is the reference ranges are based on sex and age. So male, female, greater than 13, less than 13 years of age will have different reference ranges for the markers. So that's just important to recognize, because what sometimes you can see happen is if you're doing an organic acid test, for example, on your child, and let's say you do one when they're 12, and then it's maybe a couple years later you do another one, the reference ranges will have changed based on their age. Okay, so this is an OAT sample of a child. And there's a lot going on in this particular test. And let me just give you a quick overview of what I look at first, okay? This is page 1. So the top of page 1 is what's looking at the yeast and fungal markers. And there are a lot of different markers on this section. The marker I look at first is number 7, which is arabinose. Arabinose is linked to the invasiveness of Candida. In this particular case, the level is fairly high. It's difficult for me to give an absolute level of just that marker based on, mild, moderate, or severe. Also, you have to understand that the marker itself is a number. You still have to determine how impacted your child or your patient is by Candida. But a 354 with a reference range of 56 is definitely a very high level of arabinose. So we know that we've got Candida occurring. Tartaric is a marker that can sometimes show up when arabinose is occurring, but not always. Probably in about less than 10%, maybe even 5% of the organic acid tests that I see, when arabinose is present, the tartaric is present. It's not that common. The one that shows up most commonly is arabinose. That's linked to Candida. At times, you will see a few other things like carboxycitric or citramolic, etc. And those also indicate some type of candida or yeast imbalance in the digestive system. Markers number 2, 4, and 2 and 4 specifically are very strongly linked to mold exposure. Aspergillus mold most common. Great Plains is coming out with a mold panel fairly soon, a mycotoxin panel, excuse me. For some people, it's linked to food. Others, it could be environmental exposures. You have to do some investigation into that. And I've seen in many cases, sometimes it's just a food exposure source from eating, mold on grains or moldy fruit, for example. So in this particular case, we know that we've got to deal with candida. That is a priority item based on page 1. The next section that my eyes are drawn to is number 16 and number 17. And the reason is that in about 20 to 25% of all organic acid tests assessed or tested, and this includes my practice, about 20-25% will show up with one of these two markers, either HP-HPA or 4-creosol. When one of these markers shows up, about 80% of the time, it's the HP-HPA. This is important because these are two markers that give a strong indication into the presence of different types of Clostridia bacteria. We don't want to just assume that all of the problems that are happening with somebody is due to Candida. If Clostridia is present as well, it needs to be addressed. It needs to be treated, whether it's with antibiotics or botanicals. Now, in many cases, sometimes you can deal with the Candida and the Clostridia together. Sometimes you'll see the 4-hydroxyphenylacetic appear, not very commonly, and very rarely will you ever see the 3-indoleacetic acid. Now, again, these are my experiences in practice. 4-creosol is linked very strongly to C. difficile. HP-HPA, one of the Clostridia that produces it, is Clostridia botulinum. So that's always a possibility. So this is important to recognize. In this particular case, we've got not only Candida, but we also have Clostridia. If we had to create a scenario of priority of intervention, and personally I like to try to treat both simultaneously, but if we had to put a kind of sort of a hierarchy to it, then I'm going after the Clostridia first. You do not want to just leave Clostridia alone and just assume everything is linked to Candida. Now, as we transition into page 2, the next place I'm looking is number 21 to see if the oxalic marker is high. And as we can see in this particular case, it definitely is. So we now have a test that shows high Candida, high Clostridia, and high oxalates. Why that's important is that other sections on the organic acid test can be negatively influenced by the presence of other toxins, namely these mitochondrial markers. Glycolic, the Krebs cycle metabolites, and the amino acid metabolites at times can be negatively influenced because of Candida, because of Clostridia, or even oxalate, or a combination of those. That's not the end of the story, because what is now occurring, Dr. Shaw has talked about this in previous webinars. I've talked about this as well in previous webinars and through my websites. Mitochondrial imbalance can also occur because of other stressors, chemical exposures, heavy metals, issues related to inflammation, for example, could also contribute to that problem as well. One of the markers to look out for on any organic acid test is succinic. Succinic now appears to be a really strong independent marker for mitochondrial damage. Now, at times you'll actually see succinic sometimes, low level, 20 to 25, for example. roughly, again, it's difficult to give an absolute number, but levels above 50 would generally indicate a more strong problem in the mitochondria. But again, candida, oxalate, clostridia could also be contributing factors here. So the priority often becomes dealing with those other problems, dealing with the candida, dealing with the clostridia, and also trying to modify and reduce oxalates over time. It's not always a simple fix, okay? It can take sometimes months for these things to change. But one of the things that's important when you see these mitochondrial markers high, particularly the succinic marker, it's strongly recommended to do the GPL tox screen as well as the glyphosate test as well. I'll say just one thing about glyphosate. Let me just go back real quickly. I don't want to get too much off into a lot of other testing, but glyphosate, we know, is that ingredient in that's used all around the world as an herbicide. And what it does is it disrupts the normal healthy bacteria in the digestive system. And as those bacteria are altered, we can run into a situation where opportunistic bacteria like Clostridia can now, they seize the opportunity to become more problematic. So in the presence of glyphosate, treating Clostridia can be more difficult. And I've had some experience now where actually the treatments that have worked for some people are now being resistant. They're not working as well, and I believe in many cases it's because of elevated levels of glyphosate. So what you can start doing is you can do the organic acids test, the GPL tox test, and the glyphosate test all as a one panel option. Not a bad way to go. Okay, so I can't say specifically in this case if there's one primary thing causing mitochondria. I can tell you a little back history on this. This individual also has a lot of chemical exposure too. So in most cases, it's a combination of things. Now, at the bottom of page 2 is the neurotransmitter metabolites. And this is an important area to look because when you have Clostridia present, either the HPA, the 4-creosol, and sometimes that 4-hydroxyphenylacetic marker is high, at times you will see this dopamine marker elevated too. It doesn't always occur. It's not an automatic. And remember, any given test you do is a snapshot in time. Our body and our biochemistry is dynamic. Things are constantly changing and shifting. But if things are in balance, we should stay within a relative range of normal. It's kind of like blood sugar, right? There's a range of normal. It's not always just exactly, 105 or 106. There's a range. And when we start to deviate outside the ranges is where imbalances can occur. In this particular case, we notice that the HVA marker is not elevated. Now, that doesn't mean that the Clostridia isn't a problem. It just hasn't gotten to the point yet that it's causing these dopamine levels to become elevated. But if you were to leave it alone, it could be 2 weeks, could be 2 months, it could be 6 months. Eventually, it's going to cause problems. And the other thing to understand too about biochemistry, there's other competing factors. There's other things that are compensating for or providing support in other areas. But this is a common scenario where the HPA is high and we've got elevated dopamine markers, not in this case, but the next case I'll talk about will show you that'll be a different story. You see the markers are extremely high. This section of the test also looks at imbalances in serotonin metabolism and can give us an idea of something called quinolinic acid toxicity. When quinolinic acid is elevated by itself, it can be neurotoxic. most of the organic acid tests that I see, even in autistic kids, even in autistic children who have a lot of candida, a lot of bacteria, a lot of toxins, the quinolinic acid level by itself is normal. So it's not a real common marker to see high, but it's worth paying attention to. Fortunately, maybe less than maybe 10, 50% of the oats that I see is the quinolinic acid elevated all by itself. Now, you can get a ratio discrepancy where the 5-HAA, let me erase this, where the 5-HAA is low, and that can cause this ratio to be high. That is showing you that there is a pull, if you will, away from the serotonin pathway, more into the kynureninic and quinolinic acid pathway. Again, a snapshot in time when you do one of these tests. That typically is happening because of stress. Mental, emotional stress, physical stress through the activation of cortisol, chronic infections, bacteria, viruses, candida, etc., can also cause that shift to occur. The top of page 3 looks at folate metabolism. In most cases that I see, whether it's in kids or adults, the folate metabolism markers are normal. When they do show up abnormal, it's usually uracil. Probably about less than 10% of oats that I see have elevated uracil. And what that is linked to is a folate metabolism problem. Now, this could be the whole MTHFR, methylation imbalance. It could be a deficiency of folate in the diet. You don't really know. You got to do some further investigation into that. But if it's elevated, it's typically worthwhile to provide some type of folate supplementation, even if it was 1,000 to 2,000 micrograms of L-methylfolate daily. What isn't uncommon, I should say, is seeing abnormalities in the fatty acid and ketone section. You notice in this particular scenario, every marker is elevated, but they're not extremely high. We're not looking at levels in the hundreds or the thousands. One of the things that can cause these markers to be high is in people who are using a lot of oil. So coconut oil, olive oil, MCT oil, they're using it in their diet or they're cooking with it. It can cause these markers to show up elevated. It doesn't mean that there's a disease problem. It just means that at the cellular level, there's a bit of a struggle for the cells to try to keep up with the metabolism of fat. And so one of the things that can happen is you can either cut back on the consumption of the oil or sometimes use L-carnitine supplementation as well to help. Now, there are underlying metabolic diseases that can manifest with elevated ketone and fatty acid markers. Usually the markers are going to be exceedingly high. It's not uncommon on an organic acid test to see a few markers elevated just by themselves. Suberic. That marker, often just by itself, many times is linked to an overnight fast. Adiptic acid, sometimes you'll see elevated in people who consume a lot of gelatin, so gelatin capsules or things like that. You need to know a little bit about the backstory. In this particular case, cooking oil, like coconut oil, was used. I can't remember if olive oil or whatnot was used as well. Page 3. Now, this is an important area, particularly when looking at things related to deficiencies and toxins. Notice on this section, we've got markers that have an asterisk next to them. These are called indirect markers as an assessment for a potential deficiency of a nutrient. So what that means is, in this particular case, if the asterisk marker is elevated, it would indicate a deficiency of that nutrient. So if methylmalonic is high, it means there's a deficiency of vitamin B12. Compare that to the markers that don't have an asterisk. So these are more direct markers. So B6, when the marker is low, would indicate a lack of B6 in the body. In this case, it's normal. Sometimes it just shows up normal because the person's on B6. So methylmalonic, glutaric, 3-hydroxy, 3-methylglutaric, and methylcitric. All are indirect markers. Notice in this particular case, the marker for CoQ10 is high, indicating a deficiency of CoQ10. If we look back on this test, CoQ10 is part of the cell involved in mitochondrial activity. This individual had a lot of mitochondrial markers that were high. So clearly, one of the things that's contributing to the mitochondrial markers is a lack of CoQ10. It's not the only thing, because there was the yeast, there's the Clostridia, there's the oxalates, etc. One other thing before I leave this page, and this is just something to watch for, and this is just a trend that I've seen. This is just a suspicion. But I will commonly see the riboflavin marker slightly elevated at about that level. Sometimes it's like 1.5 to 1.8 or so, when there's a lot of candida. So one of the things that the enzymes that help to break down, one of the byproducts of candida metabolism, acetaldehyde, is vitamin B2. So that may be one contributing factor to that. Okay. One other thing on this test is, right, let me erase this. It's not happening here, but, and this is because the person was taking a lot of vitamin C. It's not uncommon to see low levels of ascorbic acid on the organic acid test. And don't think that that is necessarily an indication of a vitamin C deficiency. You're not dealing with somebody who's about to have scurvy. Ascorbic acid is metabolized very quickly in the body, particularly in the bloodstream. And so what's advocated when you see ascorbic acid low is that ascorbic acid can be used, but to probably dose it multiple times throughout the day, because if you take a dose at 10 o'clock in the morning, and then you measure your ascorbic acid levels at the next morning at 6 a.m., well, it might show up low in the urine. And that's only because in the bloodstream it tends to get metabolized, used up pretty quickly. But that doesn't necessarily mean that there's a deficiency of vitamin C at the cellular level. Okay. Page 4, the indicators of detox. Notice again that we've got two markers that have an asterisk. The one that's most common to show up abnormal on this section of the test is the pyroglutamic. It is an indicator of glutathione status. When it's elevated, it indicates a glutathione deficiency. In this particular case, you'll notice that it's just high normal, okay? It's barely normal. And so again, if we left everything alone for 2 weeks or 2 months, you'd likely come back and retest and find that this marker has become high. This person is trending towards a glutathione deficiency. And it makes sense from all the markers that we see positive on the test. The 2-hydroxybutyric is linked to the pathway that is linked to glutathione production. So at times what you'll find is you'll see erase the markers, is you'll see a normal, in this case semi-normal, but a normal pyroglutamic, but an elevated 2-hydroxybutyric. Okay, and so the system is stressed, those pathways are stressed. And so it does make sense to do, if you can, some type of glutathione support. The orotic acid is often linked to ammonia production, most commonly coming from the gut, most commonly associated with bacterial imbalance, bacteria dysbiosis in the digestive system. The 2-hydroxyhyperic, that's not abnormal in this case. Most of the time you see it, it's about 1.5, I don't know, to maybe 2.3, something like that, okay? Artificial color and flavoring could be acetaminophen use, might be a bacterial imbalance. In most cases, when I've seen the levels really high, you know, let's say greater than 30, if you check what the person's consuming, they're usually consuming a lot of diet soda, so NutraSweet. I have seen some elevated levels above that in the use of a Tylenol as well. The last section of the organic acid test on page 4 is this section called amino acid metabolites. This is really the oldest section of any organic acid test. It's really there to help pick up on inborn errors of metabolism, to look for serious metabolic disorders. In the vast majority of oats that I see, if there's a marker elevated, it's just slightly high, you know, 1.4 here, or, you know, if we took number 67, it might be a 0.45, something like that. A lot of times these things will tend to self-correct when somebody is given some multivitamin and mineral. You treat candida, you treat clostridia, you deal with some of the other bigger issues. The phosphoric marker seems to be related fairly strongly to vitamin D status. So a low level would tend to correlate more with the need for additional vitamin D. High levels, which don't occur that often, but I have had a few cases where the levels were quite high, it traced back to the consumption of soda pop. So because most of the traditional soda pop has phosphoric acid in it. Okay, so that's kind of an overview of kind of how I look at, so in this particular case, really the high priority items is the clostridia, treating the candida, dealing with the oxalates, and doing some type of support, you know, multivitamin, mineral, mitochondrial support, but we've got to deal with those, the big ticket items, which is the yeast and the clostridia. Now, let's do a sample oat on an adult. Okay, this is an individual who's struggling with some neurological issues. Somewhat similar to the first test, okay? Remember the first test showed an elevated 5-hydroxymethyl-2-fluoric, okay? So there's some kind of mold exposure. Is it food? Is there some type of environmental exposure in the home? That can happen to mold damage in the home. The arabinose level, not so much, okay? Certainly the arabinose is high, indicating some candida, but the previous test had what, a level of over 350. We're sitting at 62. So I'm not saying it's a non-issue, but it's not the only thing that we'd pay attention to. So what do we want to look at next? Well, we want to look at the bottom of page 1. Let me move this thing around here. Okay. Notice, I've got to move this. So I know you're seeing my cursor jump around here, but I've got to move this thing out of the way. Look at the creosol value. 1100 and almost 1160. That's one of the highest levels I've seen. Look at the 4-hydroxyphenylacetic acid. Notice that Clostridia difficile can produce both. If all we did was assume this person had candida and didn't assess these other bacterial problems, a tremendous amount of information would be lost. This is a huge priority to deal with. They do have some other bacterial imbalances, okay, number 12 and number 13, but those are rather non-specific. That just indicates some dysbiosis. It's this guy right here. That's the one that is the most concerned because it's linked to the production of both of these toxins. And why is that important? Well, remember, if you've listened to some of my previous webinars, the Clostridia toxins, 4-creosol, HPHBA, 4-hydroxyphenylacetic, have a chemical structure that allows them to inhibit an enzyme called dopamine beta hydroxylase. I just posted some information on this on the two places. One was the Integrative Medicine Academy Facebook and also the Autism Recovery System Facebook. And I have videos on this in the Autism Recovery System website as well. The dopamine beta hydroxylase is what converts dopamine to norepinephrine. And when we block that enzyme, you get a rise in dopamine. Too much dopamine is neurotoxic. It overstimulates the dopamine receptors, eventually leading to breakdown of the dopamine receptors, leading to neurological problems. In autistic kids, dopamine can lead to aggressive behavior, self-injurious behavior. In extremely high levels, it can lead to psychosis, depression, etc. So this individual has very high levels of that 4-creosol that could certainly be contributing to dopamine excess. Let me just skip ahead. We'll come back to page 2. But if we go directly to the bottom of page 2, if you take a look, notice that the homovanillic marker is very high. This, again, is one of the highest levels I've ever seen. That's extremely high. So we got high Clostridia, high dopamine. So this is creating potential problems. And the ratio is high as well. I mean, it's high because just the homovanillic acid is so high. So again, dopamine, okay, and that byproduct HVA, I can't draw real well on this, wants to get converted to norepinephrine with the byproduct VMA. Clostridia comes in and blocks that enzyme. It's also possible for people to have a polymorphism in that enzyme too, which would weaken its ability. If you have both, well, it's a double whammy, unfortunately. When you block that enzyme, there's an increase in dopamine. And then eventually you get a spillover effect of an increase in HVA, which is what's happening here. Okay. Let me do this, sorry. All right, let's go back. Okay, here's our Clostridia, very, very high. We've got a little bit of yeast. So here's our page 2. Next place I look to look is oxalic, okay? High normal, but it doesn't really appear to be much of an issue at all, certainly not like the Clostridia. Notice the mitochondrial markers. Not much to talk about. Okay, the low values are clinically insignificant. There's nothing elevated. So despite the fact that the person has very high levels of Clostridia and the dopamine levels are high, well, the mitochondrial markers are not. And so that's a good thing. It doesn't mean that if you left it alone, eventually we might start to run into mitochondrial problems. I just had an article, I posted it on Facebook the other day, that actually shows that elevated levels of dopamine break down into something called dopamine O-quinone, and dopamine O-quinone has a toxicity effect against mitochondria. So remember, depending on diet, other supplements people are taking, hereditary factors, other things going on in the body can compensate for a period of time as well. So it's not an automatic that we're going to find every single one of these sections lighting up when we have a severe problem like bacterial or Clostridia issues. Also notice in this case, quinolinic acid levels are not high. This person's got a really bad infection, but quinolinic acid levels are normal. So again, it's not an automatic. But the more these markers show up, that indicates the more significant problem at a cellular level. The folate metabolism looks fine. No elevated markers on the ketone fatty acid section. So if I was just to look at this test on paper and didn't know anything about the individual, I'd say, hey, there's a big problem with Clostridia. But for the most part, the other metabolic markers look pretty good. Even the nutritional markers don't look bad. Okay, so we've got ascorbic acid levels look healthy. There's not a CoQ10 deficiency. I mean, you know, there's not a lot to talk about here. What's really surprising on this individual is despite the elevated levels of dopamine, and despite knowing the breakdown toxicity of dopamine and producing those dopamine O-quinone chemicals, which have such a detrimental effect on the cellular level at the mitochondria, they also rob the body of glutathione. We don't see any deficits of glutathione, except in this case, the level is certainly high normal. Okay, I'd maybe like to see it somewhere down here. Not a lot to speak about on page 4 either. Phosphoric levels look normal. Amino acid metabolites look normal. This marker right here is kind of interesting in that it can indicate some type of a problem in metabolizing the amino acid tyrosine. So let me backtrack here real quickly. Clostridia bacteria will use or can use the amino acid tyrosine to make 4-creosol. Other Clostridia bacteria can use the amino acid phenylalanine to make HPHPA. C. difficile really likes tyrosine. Okay, so it really likes the amino acid tyrosine. And in the presence of high exposure to tyrosine, the C. difficile will grab it to produce 4-creosol. Okay, and then again, phenylalanine. So it's a problem in the presence of these Clostridia bacteria to be using some of those amino acids, or I should say it's a potential problem. I never want to say it's an automatic. Well, what was happening or what's going on in this individual is that they are using fairly high doses of tyrosine to try to increase dopamine levels. And the issue that's occurring, or seems to be occurring, is that because of that reaction, because the presence of Clostridia is present, it's using the tyrosine in a disadvantaged way. It's driving the creosol numbers up too high. It's driving then the dopamine levels up too high, and we're now getting a major production or overproduction of dopamine. Now, typically what you would see is that over the long term, as the dopamine levels are high, you would see the body get robbed of antioxidants, particularly glutathione. But notice the glutathione level is high normal. Well, it turns out that one of the things that's done sometimes when the high doses of tyrosine are used in some certain protocols out there is that also high levels of cysteine are used. And if you read about cysteine, cysteine is it's one amino acid as a precursor. Did I spell cysteine right? I before E, except after C. Anyway, cysteine is the precursor to glutathione. So they're taking high doses of cysteine as well. And so what may be happening is we're getting some type of balancing effect where the cysteine is helping to stimulate the production of glutathione, and that glutathione is sort of holding its own sort of against all the excess dopamine. But in time, again, it goes back to in time, if you left well enough alone and just sort of, not dealt with the scenario, eventually this person is going to fall off the edge. Eventually this pyroglutamic level is going to go elevated. And then you start to run into deficits. And these, antioxidant problems are occurring because of that. So again, it's kind of good. You always need to know the back history, whether again it's for your own child or for patients in your practice. And there's 1,000,001 different scenarios out there. So I'm hoping that this gives you at least some insight into how to do kind of a quick assessment. I'm always looking at page 1, I'm looking at Candida. Do we got Candida or not? Do we need to deal with it? Yes or no? Do we have Clostridia? Are one of those markers elevated? If it is, it's a high priority intervention for me. Is oxalate high? Okay, it's high. Is that a priority? Yes, but it doesn't take precedence over the Clostridia. Do we have elevated levels of HVA? If we do, we know we've got a more severe blockage problem on that dopamine beta hydroxylase. Are mitochondrial markers present? If they are, then I'm probably going to also start looking for chemical exposure too. And I know minimally I need to do some kind of mitochondrial support, CoQ10, carnitine, some antioxidants. But we got to deal with the bigger issues first. We got to make sure we're dealing with the Clostridia, etc. Okay, let's see here. All right, so that is really an overview on how to review an organic acid test. What you want to try and avoid, and this is one of the things that I teach a lot in the organic acid test seminar that we do, is to look at the big picture. If you look at any given organic acid test, particularly the first one that I showed, you could end up having somebody on, you could have them on 50 supplements. It's just not practical. It's learning how to keep the big picture and then focusing on certain big ticket items. Clostridia, mitochondrial deficits, glutathione deficiency, etc. It's okay to come back and retest in a short period of time. Maybe it's 2 months or 3 months, depending on how many markers are elevated. Typically, I will come back and repeat an organic acid test in about 3 months or so to make sure we're making headway on our interventions. As a maintenance test, I recommend doing it at least once a year. Okay, if you came on late, and again, I know there's a lot of information in this, so hopefully you've got a little bit of deeper insight into how to kind of do a quick assessment. If you are working at all with special needs kids, or you're a parent or caregiver with a special needs individual, you can always find me in the autismrecoverysystem.com website. There is a forum in this site, okay, where people can post me questions and I can create an ongoing dialogue and answer questions there as well. Again, there's a lot of other information too. You got the autism course, we got videos, etc. If you are a healthcare practitioner, if you're a parent, as well, and you don't necessarily have a medical degree or a health practitioner's degree, you're welcome to these courses as well. Integrated Medicine Academy is we have an extensive library of courses that we do. I'm about to relaunch Autism Mastery course, which is an extensive, detailed course designed for healthcare practitioners on the implementation of biomedical intervention for autism. We're going to be redoing an Adrenal Mastery course coming up here starting in later this year. I think it's October, November. We also have a Toxicity Mastery course that we'll be launching as well. That's going to go through different aspects with regards to heavy metals, chemical exposure, glyphosate as well. You can go to Integrative Medicine Academy on Facebook and follow us there. Again, I try to post things to those Facebook pages on a daily basis. We also provide access to lab testing. So if you need assistance on getting access to certain labs, you can go to labtestplus.com. We carry a lot of the Great Plains test, the oat, the hair, the toxicity screen. One of the things that happens when you order through this site is the test comes to us, and I do a personalized written review on the findings and on the relevant markers on that test, and then provide what are called action steps, suggestions, supplements, etc., based on those lab tests. If you have lab tests that you've done through another practitioner and you want another pair of eyes on those tests, there is a lab review section in this website that you can order and have me look at those tests as well. So you can just go to labtestplus.com and look at those various sections. I'm also available for private consultations. The best email to reach us for inquiries into private consults, whether it's phone or internet consults, etc., is scmedicalcenter@gmail.com, and there is our phone number. So I hope everybody found that useful. I realize it's a lot of information. I'd encourage you to go back and look at some of the past webinars that I've done through the Great Plains webinar library. And then, of course, I gave you the websites where you can reach me for ongoing information and questions as well. Okay, thanks everybody. So I will see you, we'll be back next month for another installment of these complimentary webinars from Great Plains. We'll see everybody soon. Take care.